Oh, thank you. Okay, pursuant to Governor Baker's March 12th order suspending certain provisions of the open meeting law and the governor's March 15th order imposing strict limitations on the number of people that may gather in one place due to the outbreak of the coronavirus, this meeting of the Town of Berlin Select Board will be conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time. The Town of Berlin will use best efforts to post an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting on the town's webpage, the town's YouTube channel, and approved minutes will be posted to mytowngovernment.org. For this meeting, members of the public who wish to attend the virtual meeting may attend via Zoom webinar platform in one of two ways: with both audio and video access, or by telephone audio only. Should any board member have technical difficulties and or lose access to the meeting will recess for a period of time to see whether access can be restored. If not, the meeting will be continued to another date agreed to by a majority of the board or adjourned until our next scheduled meeting. All righty, and we'll call the meeting to order at 7:06. We've got the approval of minutes for November 30th open session and December 10th coffee talk. Do I hear a motion?
So
So
moved.
moved. Or
And
seconded.
All right, you get to pick who you want. The motion.
Mary's call.
All right, then if you have no questions or comments, we'll take a vote. Keith, aye.
Stone eye.
Hawkins, aye.
Okay, that's unanimous. And under correspondence, we have a letter to Lighthouse Environmental about Maplewood trucking.
Through the chair, the letter is actually to representatives of the owners of the of Maplewood Farm. The board has, and I and the chief have received recurring reports from residents along the trucking route that trucks aren't complying with the agreed to times for trucking material to the farm. And that they haven't abided by the trucking route. So trucks have come down roads they should go up and things like that. And I thought that it was in the town's best interest at this point to send a letter to the representative from the board cautioning that this is not allowed under the agreement and that further action could result. The draft letter, Mary has prepared the draft letter and it's in the board's agenda folder tonight.
Did I miss that? I didn't see it.
Oh, it was
Yeah.
There.
actually, or was
It was-
emailed maybe.
It's in
Because I re-
correspondence.
I remember reading it. I don't know where I read it, but I remember reading it.
It was attached to
Okay.
an email earlier too. So
All right.
I have a couple of suggestions, like minor tweaks to the letter, but the sentiment is there.
Okay. And Peg and Scott, are you okay with the letter?
Mhm.
Yes.
Okay. Do you want to vote, Margaret?
Yes, please.
I move we
To
support to authorize the letter as written, allowing Margaret to make non-material changes for clarification's sake.
And seconded.
Okay. And we'll take a vote. Keith, aye.
Stone eye.
Hawkins, aye.
That's unanimous.
So Margaret, when do you, will you send this out tomorrow, and are you expecting a response?
We don't necessarily need a response because it's really just a notice that we've received these things that really should be for them to fix it.
Okay.
But I thought that it was time for the board to do this. So it will go out when Chris is able to sign.
Okay. Well, when it's ready, let me know and I'll come down.
Okay.
Okay. General public comment. I see no hands. So we will move on to our department update. The police, which is Tom Galvin.
All right, I made it. How's everybody?
Good.
Thank you.
Just a quick comment on that letter for Maplewood. Been in constant contact with Lighthouse, and we've been able to resolve some of the issues. But I think the one big issue at this point that we've kind of reached an impasse and have a fundamental disagreement about is the time of trucking. And that's a concern of a few of the neighbors that, the trucks are rolling up the hill, prior to 7 a.m. And we just can't seem to come to any kind of agreement on that. So I think it's important that this letter goes out and we see what their response is.
Okay.
So, unfortunately, we received, and then we talked a little bit about this, and I think there's some emails, we received a notice on 2 of the grants that we've applied for in the past. One was a burn justice grant, which we applied for the use for body cameras, and the other was a community compact IT grant. We did receive 50% of the funding on the burn grant. I'm working right now with a couple of different vendors to see if we can make things work.
Excuse me, Chief. Excuse me,
Yeah.
Chief. Could you please just get a little closer to the mic?
I'm sorry, I'm using a headset, so it's not
Oh,
the mic on the computer, so I'll try and talk louder.
okay.
And I'm working also, I've been in contact with Meg Kilcoyne, our new state rep-elect, and to try and look at some potential supplemental funding. So we're looking into that as we move forward. And then unfortunately, we did not receive the Community Compact IT funding. So that's something we'll again look at next year when that next round of funding becomes available. But we're still going to continue looking into what we can do to improve the radio system with the funding that we have. So we'll, that budget shortfall or the grant shortfall on the body cameras could be a potential problem, but I think I have a resolution and have a company that can come in with a product that will work and is within the budget. So I'm still working and hopefully to have something finalized very soon with them.
And how far we were planning on going with that grant? So it was to get a demo project, or was it actually for
No,
permanent
this
cameras?
was actually permanent cameras to move forward. So what I had applied for was enough funding to purchase 1 camera for use by every full-time officer, and then a small pool of cameras to be shared by the part-time officers when they work, and then the back-end storage, a server to store all the video data. Ultimately, I would have liked to have seen or had the ability to apply for enough funding to have cloud storage on the video. I just think from a public trust perspective, it takes that potential away that something happens and damages our server or something, that there's a third party that's holding onto that video. Unfortunately, that cost is just too much. And we couldn't afford that at this point. But I think we'll be able to work with what we have and make things happen.
So Chief, with the 17,000 that you're getting, I mean, how many cameras can you buy right now today?
That's the question. So that depends on vendor and product. And that's why I have a vendor that seems to be willing to offer a discount on the products. And that way I'll be able to get enough that if I'm not able to do it as I originally planned, I'll be able to get enough of a pool that will always have cameras charged that officers coming on duty will be able to use. So that's the ultimate goal. Somewhere in that 8 range is I think what we would need in order to make it happen. And then it's, and the back end, that data storage, that doesn't change. It's the number of users and the number of shift hours. It's going to be the data storage.
So along with Meg Kilcoyne, have you reached out to, and I don't even remember his name, sorry about that, the gentleman who defeated Senator Tran? Have you reached out to him as well?
John,
What
I
was
have
that?
not.
Yep.
I have not yet. Meg actually was the one that notified me that we had received the grant and has been very willing to help. But his new chief of staff, or I don't know what her title is going to be Susan Templeton, who was Hank Naughton's. So I can reach out to her to find out what we're doing. Meg said it was kind of going to be a couple of months maybe before we're able to do anything until the potential of supplemental funding after the initial budget gets passed, and then what other things are going to move through the House and the Senate.
So if you're only able to go ahead with, I think you said 8, are you going to purchase them anyways? I mean, you're not going to wait, are you? Because
No.
you're expecting more?
No, as long as we can get enough that we can, I would hate to, I wouldn't want to do it and then run a program where it's, well, the day shift can wear them, but the evening shift can't wear because they have to charge, and then the night shift can wear them. You know, it's going to be, if we can get enough that we can run it and have everyone have something available to them every shift that they're working, then we'll move forward with it and won't wait. So as we started November, you may have noticed officers were wearing the veterans patch again. That's going to be kind of our normal uniform for the month of November. And officers were probably starting as the month progressed and now into December looking a little bit shaggier on the face. It was no shave November. So this year we've actually extended that into December, and they're fundraising for Cops for Kids with Cancer. And so they've paid extra to participate in November and December. So some of the officers shaved at the end of November, and then there are a few that are participating until the end of December. And you know, as we get midway through the month, I'm gonna, you know, we'll see how many of them actually make it. There's a lot of itchy faces and complaining as we continue through the month. But overall, November was, I hate to use the word quiet, but it was a relatively quiet month for us. You know, 866 total incidents. You know, our numbers were down with only 9 motor vehicle crashes, fortunately only 1 with injury. And we only had 4 cases with criminal charges. But I wanted to highlight one of those cases, but highlight a couple of the things that we did this past month. And just some of the things that we're dealing with. And one, I want to talk about a little bit of frustration that it creates. The first was an incident where we actually responded to assist in Clinton. And it was a large fight call with potentially a firearm involved. And it just showed that what dangers are still out there, that the officers actually responded. They assisted in kind of quelling the disturbance. And actually the reported firearm was actually recovered, and someone was arrested with that. So, you know, that kind of stuff we hear that goes on in the city and on the news is actually right in our backyard here. So just something that we have to stay aware of at all times. But kind of a little more of a convoluted call happened early in the month. And it started out as just a call for a shoplifter at the mobile station. And officers responded, and it was more of a disturbance when they arrived. They learned that the individual that was suspected of shoplifting had, prior to the officer's arrival, tried to enter a car in the parking lot that happened to be occupied. So the husband of the woman that was in the car was confronting the gentleman in the store. They further learned that prior to even getting to the store, this gentleman had tried to enter someone's home, and the people from the home down the street had followed the gentleman to the store. So there was kind of a large confrontation going on as officers arrived. The officers were pretty quickly able to determine that there was some sort of mental distress that this individual was going through. They requested that the ambulance come, and they really made the right determination at the time that arrest wasn't the best option, that it was to get this person and get them to the hospital and get them the help they needed. As the situation progressed, the fire department came to assist. They got the individual into the ambulance and began their evaluation. And officers' attention kind of got turned to another portion of the case where a car just down the street was found, and it had been stolen from an employee that was working at the Gulf Station. Later determined that this individual actually had been at the Gulf Station, stole the car, drove down the street, dumped the car, tried to steal some of the items that were in the car, went to the neighbor's house, tried to enter their home, and then ended up at the gas station. While all this is figuring out, the individual actually escaped from the ambulance and ran away from the EMTs. So with the assistance of our neighboring communities and Marlboro's K-9, they were actually able to take the person into custody. At this point, he was placed under arrest, but he was still transported to the hospital. And really kind of what highlighted things for me and really became frustrating for me is this was someone who was in need of services at the hospital. And we're talking about police reform now and how we handle everything and handle, you know, they want to take a lot of things in dealing with mental illness off of the police's plate, which is a great thing. There's people out there that need services that we aren't the ones and shouldn't be the ones that are delivering. So this individual, although in police custody, was taken to the hospital. He was evaluated by a doctor on an iPad and released to us. And it immediately decided to destroy the exam room once he was being released into our custody. So the officers convinced the nurses on site to again get the doctor onto the iPad to do a virtual evaluation, and he said, nope, he's fine. And the official diagnosis was bizarre behavior. and he was released to our custody to spend the rest of the weekend because he couldn't come up with a small amount of bail. It's really frustrating that this still goes on, that, you know, even we are trying to get these people help in the services, and we're not getting it from the service providers either. So there's a huge disconnect as we move forward with police reform and trying to make sure that, you know, as police officers, we're not stuck in the middle of things that we need doctors to help us out on. I had a discussion just this last week with Lieutenant from Clinton, who is going soon to be the acting chief or interim chief, and about the potential for trying to get a clinician that through a grant to work for multiple communities in the area. A lot of our neighbors have been able to do that. And to have him on board will be huge. Clinton is, you know, kind of our largest partner through the courthouse. And so we're going to start to look into something where we have a clinician available who's out on the street at any given time. And that will be a big help. But a lot of frustration that we didn't get the help that we really needed on a night like that from the medical community. And then for this individual, he ended up spending 2 nights in our jail cell in the police department. You know, not the best place for him, only to go to court on Monday morning to be released and then cause another problem in town. It was just a bad situation overall that highlights the shortcomings we still have in the mental health community and in public safety. The other thing I wanted to do was recognize some of the police officers and the fire department responded jointly to a medical call of a heart attack in the middle of the month. And as the officers and the ambulance arrived, the individual actually collapsed on scene. And EMTs, paramedics from Patriot Ambulance also arrived. They immediately started CPR. You know, we often get to these calls and CPR, and we have equipment to help people, but it doesn't often work correctly. Or I shouldn't say work correctly, but they're not in a condition where it works. So an automatic external defibrillator, an AED, was applied to the person. And before the paramedics got there, the fire department already issued 2 shocks, and the individual didn't respond, but was still viable. You know, the paramedics arrived. They actually delivered 7 more shocks on scene. It took them almost an hour to extricate the individual from a tight spot in a bathroom, get them up a hill through the backyard into the ambulance. And prior to getting to the hospital, they had a pulse. It really just highlighted the teamwork between the police, fire, and the paramedics to get somebody back, and that everything worked perfectly, and timing was on our side that day. So it's just something I wanted to highlight, that things work. Having our fire response there immediately works and helps us out tremendously, and is an asset to our residents. I touched on in my report the shared streets and spaces. We've talked about that at length over the last week or so. And Scott, I'd be interested in your feedback from Disney in terms of traffic patterns and moving people, because they seem to be very professional at that. So input might be very helpful in the future. ACO, everything was quiet this past month. Just a few loose dogs. We did get a loose cow call, but it's a cow that's down at the orchards. It's fenced in, and people seem to continue to call because they think it's free. But I have a meeting scheduled this week with the ACO, and we're going to touch base on a few things and continue to move forward. I also had mentioned before about our selection of a new police officer, full-time police officer. So that pre-employment process is continuing. But I forgot to mention one important thing. So we have now hired our first full-time female police officer. I know, Chris, we've talked about this a lot over the years. I don't think this is something to be proud of. I think, you know, we should be discouraged that it's taken this long. But Molly is going to be a huge asset to us as we move forward. And today, you know, we've sold the former Crown Victoria. Actually, the asking price online was $2,500, and we sold it for $3,500. So you know, we did really well. We had lots of offers, some obscure offers of, you know, people wanting to give some cash and Dunkin' Donuts gift cards and some other obscure things out there. But you know, we had a couple offers at $3,500, and you know, we accepted one of those, and everything worked out well with the sale of that vehicle.
Great.
Nice.
So
Well,
that is all.
kudos to you for handling the two incidents, the difficult.
Yeah.
It wasn't me. It was all the guys. It was the police and firefighters that dealt with it. I was,
Yep.
you know,
Well, and
I,
just
yeah.
being able to recognize that if it's a mental health issue, I mean, that's very important.
It is. I'll tell you about it now. That we had another one that kind of is a December issue, and we responded. I was on my way home when the call came in, and I responded with the two officers on duty. And it's a common address that we've responded to for mental health issues. And we spent 2 hours there, and were able to work, really work to a great resolution. And we've discussed the incident afterwards, and it's like 15 years ago, we would have been hands on in 10 minutes. It would not have. We wouldn't have taken the time to get to where we were to make sure that, this is a 23-year-old kid that was in distress. And it would have ended up with probably bumps and bruises for all of us. And instead, we took 2 hours of our day and his day and had a positive resolution and really some positive discussions within the family while we were there. So that, I think in law enforcement, we're evolving, we're getting better. And, if the more tools and resources that we can, get for our officers, especially with dealing with some of the things around mental illness, is going to be important in the future.
Well, kudos again. I mean,
Yes, very good.
it's really big to be able to recognize when people do need help, and I'm sure there's a lot of people out there that do appreciate that.
Well, I hope so. And and the good thing is I think most of us, when I say us, I mean law enforcement in general in the area, are doing this, and that I hope it it continues nationally, and the narrative changes, and there's a lot more positive than negative.
Through the chair, your new recruit, your officer who you're onboarding has some great experience in that regard, so she's going to be a great asset to your department.
Absolutely, that's
Great.
what she works in now, and that will be a huge help for us in the future.
So, Tom, I have two questions. On the animal control officer, I know that with COVID, she isn't able to produce documents, Word doc reports. Is she
Yeah.
writing these down to you? I mean, do you have every month as part of her responsibility that you have written animal control
So
reports?
that's why we meet. So when I meet, I will get a couple of sheets with her notes that aren't typed on the calls.
So can she just write them out to you instead of meeting? Can she just write you a letter and drop it in the green box outside?
She can. I mean, yeah. I mean, I think it's nice for us to connect and talk, every month or so, just to kind of stay, answer questions if she has questions versus, going back and forth over the phone to sit face to face. It's kind of nice every once in a while, and we're able to do that and still distance properly.
And of course, I'm sorry. Go ahead, Chris.
I was just going to say, if it's anything that you think the board, needs to know, could you pass it on?
Yep, absolutely.
Okay.
Fortunately, the last few months, a lot of it has been just missing, loose dogs and things like that she's corralled. We haven't had a lot of major problems as of late.
Okay.
And of course, my last favorite question, train trash. My contact seems to have gone away, regardless of how often I call or text. I'm not getting any response. I'm not getting any response in email. With the snow about to fly on Thursday, I'm just concerned that it's there, that we're stuck now until the end of spring.
If you actually look, most of it is gone. If you look at the ties that were along the tracks, those piles of ties, those have all been removed.
Okay.
So that I think what is still there is some stuff that they're going to reuse. I think there's a couple of piles of stone, and then there's some actual long pieces of track where they didn't. Those I believe were there left pre-construction because those are crossings that they didn't do the work on. So that those pieces will be used when they do those other crossings.
Yeah, I noticed the one on Jones seemed cleaner. The one farther down on Crosby still had a bunch of trash that had the big nail things that were still sticking out. So
I think at Crosby they have the piles of ties that they delivered like 6 years ago.
Yeah.
When I thought they were originally going to do it, so those the new ones. But I think the piles and a lot of the debris that was left along through the route has been cleaned up, and I will double check. But
okay.
I rode the route not too long ago because they had told me it had been done. So,
All right, appreciate that.
yep.
Okay, any other questions for Tom?
No, thanks.
All right. Thank you.
Thank you. And our next appointment is Cook and Company to talk about the healthcare plan design, the options and the timeline.
Everyone. Hello,
Hi, Jill.
Hey, Jill.
how's everybody tonight?
Good.
Good, thanks.
Great, great. Well, thanks for having me back, and I hope I can help sort of clarify and answer questions and help you guys get on a nice path to meeting some of the goals that the town is setting. So my goal tonight is to just make things very easy to understand and give you a few ideas about the pros and the cons to using the process, section 21 through 23. And I also wanted to show you some analysis that I've done, which can give you some specific examples of potential savings that the town could achieve either using the process or without using the process. So I wanted to highlight sort of two different ways that you might look at that. And I did send over some information, but I'm actually going to use on one of the documents. I'm going to use a different version because I just caught a little error on it. So I'm going to go off of mine, but everything else, and then I'll forward it all to you guys. But everything else you have should be up to date. And I also wanted to just say, if there are questions, this meeting is really to help everybody understand the process. So this would be a really good time to have a discussion and ask any questions that maybe you weren't sure about. Am I able to share my screen, Margaret?
I think you can share your screen if you, yeah.
Super. So again, the first thing I'm going to show you are some potential savings. And I think once you see the different plan designs that you could go with, we wouldn't expect for tonight's meeting for the select board to make a decision on what you want to propose. These are just examples. And so I'm going to be showing you really the maximum possible savings that you could achieve, and then some lower savings options as well. And this is just for your information. So for tonight, no one has to make any decisions on these, but it'll give you an idea of what kind of savings you'd be looking at. And then maybe the next time we meet, we could have a discussion about more specifically meeting those goals. So the first thing I'm going to show you is what is called a mitigation analysis. So can everybody see my screen?
Mhm.
Yes. Yep.
Okay, super. So the way that this works is, and this is the document that I'm going to send you a revised version of. So it shows you on the top section your current plan designs, including your current rates and contribution breakdown, and then also your head count. So for instance, your PPO, Blue Care Elect Preferred plan, you currently have nobody enrolled in that policy. You can see the rates, and then that on the far right, that it's a 56% contribution that the town puts toward that plan. And the next one is your HMO Blue New England, which is where all of your enrollment is at the moment. So you have 11 individuals and 20 families enrolled. And you can see the rates are $1,061.39 for an individual, to $2,601.67 for a family, and then they apply the 75% contribution. And then lastly is your HMO Blue Select, which is the limited network that was just put in this July. So nobody has enrolled on it yet. I think partially because it was not a very good year to promote new plans. So that's something that we can certainly work on, but you can see that the rates for that are lower, and that's also a 75% contribution. So your total budget for your current fiscal year 21 is 764,504. So that's the number that we're trying to reduce. And if we scroll down, this first scenario shows if you were to enroll everyone on the matching HMO plan, the same benefits and copays that match your PPO. So putting all of your plans in line with that. And we're calling it benchmark one. That's a term that Maya has used to discuss the copays and deductibles that match the GIC. And this is version 1. So this is no longer the GIC benchmark, but that's what we're calling it. So it's the 250 deductible per individual, 750 per family. So assuming that you take all of those employees and put them onto the version 1 of the benchmark plan on the HMO, and then you just go down to the bottom, you can see that the budget would be reduced to 684,614. And so that's a savings, a total savings of $79,890 from your current budget. And so what this document shows you is if you were to apply sections 21 through 23, if the town did choose to adopt that, you would then be required by the statute to return the first year's savings. 25% of that would have to go back to labor. And that's what's highlighted at the bottom. So you can see the 25% mitigation that goes toward labor would be just under 20,000. And then the town's net savings for the first year would be just under 40,000. And again, that's just for the first year. So any subsequent years, the savings or the reduction, or I would call it cost avoidance, would then 100% of that would go to the town itself. So this would probably be in version 1, benchmark version 1, the least amount of savings that you would achieve. And so the more aggressive the copays and deductibles get, the more savings you'll see because it will reduce the premiums further. So before I go on to the next version, which is version 2, does anybody have a question about any of this at all?
Does anything change going from the first one to the second, like copays or anything?
Yes, that's exactly what will happen. And I have another analysis that I'm going to show you, which does put the copays side by side so you can see that. But just for this, I wanted to focus on the total savings.
Okay.
And the reason that I'm doing that is because it's important to understand what your goals are and start thinking about how much do you really need to save, and how aggressive does the town need to be in your bottom line. So that's really where this is. But the next analysis will definitely look at the comparison of benefits.
Okay.
Okay, thanks. So I'm going to scroll to, oops. Bear with me here. There we go. Okay, so this is version, the top section is exactly the same. This is your current budget. And then when we go down to the bottom section, we can see that it's assuming all plans change, not just the HMO. So we're talking about making all of your plans align so that they're the HMO, the PPO, and that limited network, the select plan, are all on the same copay and deductible structure. So this is called benchmark version 2. And this does have higher copays and deductibles. The deductible on this plan goes up to $300 for an individual and $900 for a family. And you can see, and if you don't mind, I'm just gonna kind of get to the bottom line of these. You can see at the bottom that it reduces your budget by a total of $97,015. And if you were to adopt sections 21 through 23, again, that first year savings, 25% would go back to labor. So that's 24,254. And the town's net savings would be 48,508. And this is based on your current headcount enrollment. So you can see that the savings comes up a little bit more as those co-pays and deductibles get higher.
Excuse me, Jill, I just want to clarify. So on the far right are the total savings. In the column to the left of that is the employee share of those savings.
Right.
And the column to the left of that is the employer's savings. And then you take off the 25% mitigation, right? Okay.
Nope, you're absolutely right, Margaret. So it doesn't, the 25% savings doesn't come off of the town's share. It comes off of the total reduction. And then you go to your town share.
It basically means that in the first year, we split the savings 50-50 between the employees and the town. Because they get some of it back on their paycheck because they're 25%, their cost is lower, and then we have the mitigation fund that you're sitting
Right.
as there. Yep.
Yeah, exactly. So this is benchmark version 2. Again, it's a 300, 900 deductible. And now there's another version. Let's see. This is, again, same on the top section, going down to version 3. And version 3 goes to yet a higher deductible of 500 for an individual, 1,000 for a family, and some other copay changes as well that I'll review in a moment. So the bottom line for this plan would be a total savings of 114,828. Of that savings, 25% of the mitigation would be 28,707. And the net savings for the first year for the town would be 57,414. I actually don't recommend this because version 4 is, which we'll be looking at next, is the current GIC lookalike plan. So it's actually the plan that gives you the most that you can go to, the highest copays and deductibles that you can go to, and version 3 actually has been changed. So some of the copays and deductibles in version 4 are actually lower than version 3. So, but the savings is negligible. So you'll see when I show that to you. This is version 4. So going right down to the bottom, we can see the total savings is 114,141. The employees would save 28,535, and then the 25% mitigation is 28,535, and then the net savings to the town for that first year would be 57,071. So this particular version 4, is the closest you can get to what the GIC lookalike plan is right now by staying out of the GIC, but just matching it with Blue Cross and Maya. And this also gives you the maximum possible savings that you can achieve if you use this statute of section 21 through 23. So I think part of the question is, how much savings, again, how much savings does the town want to get at? And what is that process going to look like? And how does that disrupt the employees? And what is it that you're trying to achieve? So that's why I wanted to show this to you. Any other questions before I move on to the next? Yes. Hi.
So, Bill, is there a reason why that we're only looking at Blue, that we're not looking at Humana, United, Aetna, insert any other payer in here?
Well, I would say that you could look at other carriers in Massachusetts. Some of the ones you mentioned don't do municipal health insurance that I'm aware of. So you would look at Tufts, Harvard, Fallon. But because you're such a small group, it's really difficult to get a good deal.
Okay. No, understood. I mean, I was just curious as to why it just kept coming up blue. But yeah, I mean, numbers dictate, and there are some payers that will just be like, no, you're too small, go away. Okay.
Right. Yeah. And I think a lot of the discussion, at least from my side with Dennis and Margaret and also with Maya, is that you can probably achieve some savings and find, meet your goals by making changes with your current carrier. So if you were to take your plan and try to go outside of Blue Cross and Maya and match that in the commercial market, because your plan is so rich, you actually wouldn't be able to find it. There would be no insurance company that would insure that level of coverage. And I'm just going to be honest with you, it's really it's an antiquated plan.
Yep.
Because it's so rich and it doesn't really keep up with medical inflation. So you would be forced to change your copays and deductibles if you left Blue Cross and Maya. So regardless, I think you'd be facing kind of the same outcome, and leaving Blue Cross is certainly a more difficult challenge from the respect of your employees and the fears and worries about losing their insurance carrier. So, but we could certainly look outside if you want.
No, it's just a question. I mean, so are there other municipalities that are roughly our size that are also staying with Blue and they're not venturing out to somebody else?
Personally, I'm not working with any. I don't know if Sue has any accounts. I asked Sue to join us as well tonight, but I personally don't have any other groups of your size.
Yeah, Jill, I guess I would just state that because of the size of your group, you really need to be part of a larger group. So be part of some type of joint purchase, whether it's staying with Maya and you're pooled to a degree with all of the other communities in that trust, or going to the GIC. But for a group of, you only have 31 people on the plan, you're really too small to stand on your own.
Okay. All right. Thank you, Sue. I appreciate that.
And what is the status of like the Health Connector in Massachusetts? Could our 31 employees find decent insurance through there? Because we pay a lot in health insurance. So if we gave everyone like an $18,000 a year raise and didn't provide health insurance, could they be able to find health insurance on their own?
I mean, at this point, I think because you are in Chapter 32B, you've committed to offering group health insurance to your employees. If you wanted to completely pull out of that, I guess it's a possibility, but we'd have to look into it further.
I wasn't even aware that would be legal. I thought that we had to, we were obligated as an employer to offer health insurance to our employees.
I don't think you can get out of Chapter 32B, which means that that's accurate. But yeah, we'll follow up on it though and get you exact information on that. But my guess is it's not going to be an option.
Okay.
Any other questions on this particular analysis? Okay, so I'm going to move on to the plan design analysis, and the plan design does not, let's see, the plan design does not actually it does not factor in that 25% mitigation. So you can kind of see what the difference is. And so just bear with me here. Okay, so this is a little bit of a busy slide. Hopefully we can all see it. Okay, so here we have your current plans, which are the three, the blue, the orange, and the brown. So the HMO Blue, Network Blue New England, your PPO Benchmark 1 plan, and then the matching HMO Select Limited Network, which also is a benchmark 1. And then I put it next to, if you changed what version 1, if you went to the HMO Network Blue New England benchmark 1 plan. And again, this would align all of your plans to have the same copays and deductibles, which really would be giving more choice, because as we can see, nobody is on the PPO plan right now. Okay, so we can see that right now your current out-of-pocket maximum is $2,500 for an individual and $5,000 for a family. And that would stay the same for all of these plans. Nothing would change on that end. And just to review what that terminology is, some people get a little bit confused when we talk about an out-of-pocket maximum. And an out-of-pocket maximum is not a deductible. It is the most an individual would pay in a worst case scenario year. So it's a cap on your deductibles and copays, and it's a protection to the member. So in many instances, employees wouldn't even come close to paying that much out of their pocket. But again, in a worst case scenario, that would be the max. And then there's a $1,000 prescription out-of-pocket maximum and a $2,000 family out-of-pocket maximum for prescription drugs. And so currently you don't have a deductible on the HMO plan. And then you would switch to $275, or excuse me, $250 for an individual and $750 for a family. So that would be per person per year. Your primary care physician visits would go from $15 up to $20. Preventive services would remain paid in full on all plans. And then the emergency room would go from $50 up to $100 with the deductible applying first. And then the hospitalization, right now you don't have a copay for hospitalization. So this plan tiers hospitals based on cost and quality. And so general hospitals are in the lower cost. So it's $300 after the deductible. And higher cost hospitals, which tend to be teaching hospitals or specialty hospitals, such as Dana-Farber and Children's, those types of hospitals are higher cost. And so the copay would be $700 after the deductible. And then surgery for outpatient day surgery, currently you don't have a copay, and that would go up to $150 per procedure after your deductible. And then the next category is high-tech imaging, so MRIs, PET scans, CT scans. So currently you do not have a copay for those. And so there would be a $100 copay after deductible added onto that for version 1. And then lastly, the prescription drug copays. So currently you have a very rich plan. It's $10, $20, or $35, depending on the tier 1, 2, or 3 for a retail pharmacy. And through the mail, you actually pay the same amount for a 90-day supply. So the benchmark plan would go to $10, $25, $50 for retail. And then your mail order pharmacy would be double that. So you would get 3 months for the price of 2 months. You'd still save 1 month's copay by doing that. So that is version 1. And again, that would be the lowest savings you could achieve based on the benchmark family of plans. And I kind of broke things down for you at the bottom here, where we can see how much the rates are, what it's costing the families and the individuals, as well as the town share. So I'd like to just go to the far right in the orange so we can look at just sort of the high level. So if you were to go transition your HMO plan to this, the saving or the total cost would be $684, $614. And then if you go down to the next section, the cost to the town after contribution is $513, $461. And then the employee's share of that is $171, $154. So then we look at the very bottom line where we can see the savings. And it's about 11.7% reduction from your current rates. So that's pretty significant, especially when you're looking at possibly an 8 to 10% rate increase coming in July. So that could help mitigate some of that increase. And again, this is about an $80,000 reduction in cost. So just straight based on your contributions, without any mitigation to the employees, the town would save just about $60,000 and the employees just about $20,000. And then of course, you would have to go through a bargaining process if you did not choose sections 21 through 23. So that's benchmark 1. And then I'm going to go to benchmark 2. Let's see. Can everybody see that?
Yes, thank you.
Okay. So again, it's going to take your co-pays and deductibles just on the HMO plan, and it's also going to change your PPO and the select. So this would be across the board, all of your plans going to benchmark 2. And we can see that the copay, so the out-of-pocket maximum on the top section is the same. So it still remains at the $2,500, $5,000 per person and family, and the $1,000, $2,000 for prescriptions. What does change is you would go from a $250 deductible to a $300 deductible. And you would go from 0 to 250 on the HMO, excuse me, from 0 to 300. And then for the family, you would go from 0 to 900. So that would be your annual deductible. The co-pays for office visits and primary care would go from 15 up to 20. Again, all preventive services would stay as covered in full. And then a specialist copay, I think I skipped this in the first slide. The specialist would go from $15 to $60. So version 1 actually went up to $35. So this would go up to $60 for all specialist visits. The emergency room would go from $50 up to $100. So that's the same as version 1. And then your hospital admissions would go, instead of 300, 700, it actually went down a little bit when they made this change. So this went to $275 for a low cost or a general hospital. But the high cost goes up quite a bit. The high cost hospital goes up to $1,500 after the deductible. So that was one of the biggest differences in version 2 of the benchmark plan. And then the next category is ambulatory outpatient surgery. So right now you do not have a copay. It would go up to $250 after your deductible on version 2. And then again, the high-tech imaging would go from 0 up to $100 after your deductible. And then lastly, the prescription drugs. So we know that you're at 10, 20, 35 for retail and mail order. And they would go to 10, 30, 65 for retail, and then 25, 75, 165 for mail order for that 90-day supply. So, you definitely see some increases in those copays. And so when we scroll over here, I'm just going to minimize this a little bit. We scroll over here, we can see that the cost for this plan is $667,489. The town share of that is 500,617, and the employee share is 166,872. And then we look at the savings. So the savings, again, is a little bit higher than the prior version. So the total savings would be 97,015. And then the town would, your contribution would be, your share would be 72,761, and the employee share of the savings would be 24,254. And I also just kind of broke it down even further at the bottom, where you can see each individual employee, how much they would save. So an individual that is on the HMO plan right now, that's the blue column, they would save $404 a year. So this is, without any mitigation, that's just the premium reduction after their share. And a family would save $990. So we, would say you can take that savings and put it toward the increase in out-of-pocket costs. And then the PPO employees would save $83.10 or $203.70. Nobody is on that plan right now, so I would just focus really on the HMO. Any questions on benchmark version 2?
So both the current benchmark version 1 and benchmark version 2 have the same total out-of-pocket maximums, it looks like.
Yes, and actually all of these plans will be consistent for that. You will not see it go above that amount, which is different than if you were to go to the GIC, where their out-of-pocket costs are a little bit higher.
And sections 21 to 23 don't let us change the percent that falls to employee versus employer.
Correct. That would have to be done outside of this process. Okay.
Are you, I'm sorry, are you talking premium share? Is that
Yes.
what the question was? Okay, so that is a vote by the select board on premium shares. Correct?
So
Jill? That would take
not
a
a-
vote by the select board on changing the premium share.
So
Is
you're
it-
talking about the 75-25.
Is that what it, yeah.
Yeah, but that's not part of this process of 21 to sections 21 to 23. That normally we could do that. So
Yes.
okay.
And I would just, if that is something that you wanted to look at, I would just want to look at your collective bargaining agreements before you went with that process.
Yeah, but I think 75-25 is fair. I know that at my employer and other places I've looked, that the family plan is not normally 75-25. It's normally that the family plan is at least the difference between individual plan and family plan is not initially that generous. And in this universe where everyone, and I look at our numbers too, that when families sit down, they go on the plan that is the most generous. And so it could be we could end up saving some money taxpayer wise. We'll get the social justice side later. But if we made it the individual plan more attractive, the family plan slightly less attractive from a cost standpoint, there could be some people who just moved from family to individual, or from family to the other spouse's plan.
Right.
I still maintain universal health coverage makes all of this moot, by the way. Just, And I think it is quite odd and strange that your employers gets to determine how good your health insurance is, as well as your needs as a family in the public marketplace, which is why if potentially employers underneath 50 that don't need to necessarily offer health insurance, now that we're below that, maybe there's a way out. And actually, if you do the math and how much between the employee and the employer we're spending for these 31 people, it's about $25,000 per employee per year. And that's a serious chunk of money.
And just on the contribution, just in comparison to many other municipalities, I would say 75-25 is probably the most common. And just in my experience, I've seen others that are richer and others that are not as rich, but around that is pretty common. Okay, I'm going to just go to the next version, if that's all right with everybody. And as I mentioned in the prior analysis, version 3 really wouldn't be worth it. So I'm just skipping straight to the current GIC benchmark plan, which is benchmark version 4. And again, this is the plan that gives you the highest possible savings if you were to adopt sections 21 through 23. So this plan, as you mentioned, Scott, has the exact same out-of-pocket maximum. So we're still at the 25,000 or 2,500, 5,000 per family, and then 1,000, 2,000 for prescription medication. The deductible for your HMO would go from 0 to 500. So 500 and then $1,000 for a family. The cost for your outpatient primary care visits and office visits would go from 15 to 20. All those preventative routine services would be covered in full, and your specialist would go from 15 to 60. So very similar to the prior version. Emergency room would be bumped up from 50 to 100, and the deductible would apply. And then the hospitalization here again would go from 0 to 275 for a high or a low cost hospital or a general hospital, and 1,500 if the employees were to go to a high cost hospital. And by the way, there are only 13 hospitals, I believe, in the state that are in the high cost category. Then we look at the ambulatory outpatient surgical. So that would be, you're going from 0 to now they've tiered it in version 4. So this is the current GIC plan. If you were to go to a facility for surgery as opposed to a hospital inpatient setting or outpatient hospital setting, so it's $250 at a facility, and then a non-facility is now $150. So they're giving more choice to the healthcare consumer, and the deductible would apply. And then the high-tech imaging, again, would go from 0 to $100, and then the deductible applies. And then lastly, the version 4 had another change where there is now a deductible for prescription medication. So that is $100 per person per year, and then $200 per family per year, and then the co-pays. So your co-pays would go from 10, 20, 35 to 10, 30, 65 if you were at the retail pharmacy. And then for the mail order, it would go from 10, 20, 35 to 25 to 75, 165. And again, that's after the $100 or $200 deductible. So definitely more out-of-pocket costs on this one. And in the red, we can kind of see the bottom line here. So the total cost for this is $650,363. The town's share of that is $487,772, and the employees is $162,772. Oh, where did I go? Sorry about that. I have a rogue mouse here. Okay, so here at the bottom, we can see that the total savings for this plan, which is exactly what we saw in the last analysis, is $114,141. And without any mitigation, the town's share of that savings would be $85,606. And the employees would save $28,535 collectively. And then down here in the blue, you can see what the individual would save. So an individual employee would save $475, and a family would save $1,165 from your current rates. So again, that would really be benchmark 4 is the current GIC plan, and that would be really the highest savings that you could do unless you bargained something outside of this, outside of section 21 through 23. Before I stop sharing my screen, does anybody have any questions on this particular version of the analysis? Okay. So I just showed you this because I wanted you to see what kind of dollars you could achieve. And I know that the town is going to have to decide, if you do decide to go through this adoption of section 21 through 23, what you're going to want to propose, so you can see what your options would be. And so really the rest of the time here, I just wanted to kind of lay out the pros and the cons to adopting the sections, and then just answer any questions that you have. So I did want to mention, just kind of in the pros section, why would you adopt section 21 through 23 versus traditional bargaining process? One of the biggest pros to doing that is that you really streamline the process, and it keeps you on track, and it keeps you on a schedule, so that you can get to your goal in a timely manner. It's also very cut and dry, so they lay out all the steps for you, which Sue and I will help you with every step of the way, and it just makes it very easy. And it allows the town, again, to avoid delays, which can sometimes happen outside of this process when you're making plan changes with employees. And I think the town has experienced a lot of delays over the last few years, which is why you've hired us. So that's why I'm recommending that you use this process to get it changed once and for all. And I also think that, again, as I mentioned, it will help you mitigate that 8 to 10% rate increase that we're expecting for July 1st. So it's a guaranteed reduction for you, and some savings that I think the town can use to put toward other goals that you want to meet outside of this health plan itself. And then I did want to just kind of talk about some of the cons, because of course you have to give something as well. And so, as you know, 25% of the savings of the first year does have to be given back to the employees. And so that's less savings that the town will be able to achieve. But again, it is just that first year. Subsequent year savings will definitely go toward the town. Another aspect of this section of the law is that employees are not wild about it. Of course, no one likes plan changes either way, but many times employees feel that their voice is not heard through this process, because really it allows the town to make the decision and implement the plan regardless. So that can be a tough one. And then also a con I put down is just, it's a very rigorous timeline. So you've got to stay on track. Again, we will help you with that, but you have to pay close attention to the calendar. And I actually have put together a sample for you to kind of see what that looks like. So I don't want to scare you or stress you out over it. It's just something that you have to be prepared to do.
Jill, it looks rigorous.
Yeah, it's pretty rigorous.
Like you said, it looks rigorous.
I wasn't the creator of it. Just the messenger.
And in that line, it has a lot going on in January and February. And I believe that most of the work is going to fall to Margaret and Dennis. Is that correct? When it comes to at least town employees.
Yes. And then also with the PEC or the IAC members as well. That it does engage all the members of the IAC, which then turns into the PEC, which is the Public Employee Committee. So they'll be very much a part of the process as well.
But the PEC
do we have
is
other...
only. Oh, I'm sorry. Go ahead, Scott.
Go ahead, Margaret. Go ahead.
Oh, the PEC is only formed for the purpose of negotiating this. Then it's dissolved.
Mm-hmm.
Right. Okay.
That's exactly right. Yep.
Do we have other projects already in play that in that time frame that we should be concerned that this is going to overly tax?
That's a good question, Scott. Thank you for asking. I do have some other clients that are going through this process, or that may be going through this process. And I have a couple of other clients that are having meetings this month as well, and are at that deciding point like you are. But we certainly can manage more than one at a time.
Right.
Yeah, thank you for asking that. So if you'd like, I can kind of give you a sample, and I think I shared that with you, but I can pull that up and we can review what it would really look like for you. Let's see.
I thought it was very helpful, the calendar.
Yeah.
Yes. it
Good, I'm
was.
glad.
Yeah.
I'm going to share that right now. And I, you know, I actually, I started out by doing this on an actual calendar, but it was just, I thought it was easier to kind of just see it laid out this way than a physical calendar. So again, I did just take this information off of the timeline I shared with you last time, but I just plugged in the actual dates that I would recommend. So of course, tonight is December 14th, and we're talking about the process and the timing. And so I would say a goal, a target would be to get this done for the end of the year so that we can hit the ground running in the new year and just make sure that this goes through easy peasy. So if that's the case, I would recommend that you do put it on the agenda to adopt at your next meeting on the 21st. And in order to do that, you do have to send an advance notice of your intention to vote. So at least 2 days prior to that, you would want to send that. So probably the Friday or even the Thursday before that meeting.
That would be this Thursday or Friday if the board intends
Right.
to. Okay.
Yeah.
Right.
Exactly.
And just because it says just 2 days, doing it 4 days is
That's okay.
sort of better and nicer.
Yep. Yep.
Yeah, and you'll decide once you adopt this, you'll decide if you want to do everything electronically, which is what most of our clients do, and it really does make things go a lot quicker once everybody agrees that electronic mode of communication is agreeable.
And this notice would actually have to contain that information or a request for that information for
Right.
email contacts for those units. Okay.
Exactly, and we have all of that language for you. So all you have to do is plug in the dates and the times and the locations, and then send it to the appropriate people.
Okay.
So assuming that you do adopt the program, the sections 21 through 23 on the 21st, we would then probably want to decide what the town wants to propose. So that's again why I showed you those two different analysis. The first section, the first one that I showed you with the budgets, that would be the one that you would pay more attention to because it includes that mitigation. And so those would be the dollars and the savings once you decide what you want to present. So sometime between now and January 11th, the town should decide what they want to propose to labor. And then you would notify the Insurance Advisory Committee of that proposal in a notice, which is called the 5203 notice. And it would just outline exactly what I showed you. So that exact budget with the mitigation and the 25% savings at the bottom. So that's what you would present along with the plan design and some other documents, but that would really be the proposal itself. And it shows the savings that they would achieve, that 25% for the first 12 months, okay? And then as soon as that is delivered, that is the kickoff to this process timeline ticking. So that's, until you're ready, you don't have to make a decision on the 11th. That's just my recommendation. Once you adopt the sections, there really is no time limit where you have to make the decision as to what you want to propose. But this sample here is to help you get to your goal within ample time to implement it for July 1st. If you decided you wanted to wait another week, you probably could do that, but I think it might be a little bit tight
Mhm.
Okay. And so then by Thursday, the 21st, so you have, by the statute, you would be required to meet with the IAC within 10 days of them receiving the notice. So you've got some wiggle room, about a 10-day window to talk about it. If they decided not to meet with you, then it's assumed that they agree with it. And then by Monday, the 25th of January, or no later than 2 days after the IAC meeting or 10 days after they receive the notice, then you would actually provide another notice to the president and designee of each collective bargaining unit, as well as the retired state and county municipal employees. And then that's where you would find out the number of eligible employees in each group. And that's where you would designate your PEC, or your public employee members, or representatives, I should say. So that's really where, as Margaret was saying, that the IAC would transition to a PEC. And in a lot of cases, it ends up being the same members, not always, but a lot of times it ends up being the same people. And so just for this process, the PEC would be formed. And then once the process is over, you would just go back to using your insurance advisory committee as you have been.
Margaret, do we have a full IAC?
No, there is not a full complement of IAC members at the moment.
Okay.
I don't believe so. Mary, can you confirm the IAC has not met since I arrived here? So I don't believe there's a full complement of members at the moment. Okay.
So we could be working a little bit on that as we're working on this project, as we're getting ready for January, which is sadly 2 weeks.
I know, wow.
Yes. Go figure.
Yes, you should probably have a short list of people to contact. And so then by the end of January, January 30th, within 5 days of the receipt of the notice, the collective bargaining units and the RSCME would have to send back to you their designated representative. And then by February 2nd, so no later than 2 business days after that, the appropriate public authority, which is you, the Board of Selectmen, would give the notice from the same one that you gave to the IAC, you would then give to the PEC. So in most likelihood, they've already seen it once because they were probably the IAC members. So it's really just a formality at that point. And then on Wednesday, the 3rd of February, when everybody in the PEC has received the notice, that is when the 30-day negotiation period starts. So we're saying that February 3rd would be the beginning of that. And then you would go to the end to March 5th would be the 30-day time period. And then by February 8th, within 3 business days after you started the 30-day negotiation period, the statute requires that you inform the Secretary of Admin and Finance that you had started the process and what the dates are, and then all of the names and contact information of the representatives for the health insurance review panel. And so the process does have a panel in case an agreement is not met within that 30 days. So there is sort of a plan B if an agreement isn't met. And so the panel is comprised of someone from the town representative, someone from labor, and then a third non-partial party, which the state can assign, or in a lot of cases, Sue and I end up being that person. So I'm more than happy to be that impartial member for the panel. It's pretty unlikely that it would go to a panel, but you do have to plan for that process. And so then within 3 business days after sending that to the secretary. So around Thursday, February 11th, the PEC would select their member for the panel and send that to the secretary. So, it's just kind of semantics here. And then by February 23rd, or within 10 days of receiving the notice of the list, all the members on the panel should have been submitted by that point. And Sue, jump in here if I'm missing anything.
You're doing fine. The only thing I do want to correct is that the impartial person, the state will provide a list of 3 people, and both sides, labor and management, if they can agree on the person, then that's the person who will serve. If they can't agree, then the state will make the decision. So Jill could serve as management's representative, but the impartial person comes from a list from the state.
Right. Thank you, Sue. Okay, and then, so really that's pretty much the process. Then by April 30th, at the very latest, assuming you had come to an agreement sometime in March, early March, but that would be the absolute cutoff to inform all of your subscribers that a plan design change will be taking place and what that plan is. And coincidentally, you would also need to inform Maya and Blue Cross of that as well. So April 30th, everything is done. And then July 1st, it goes into effect. So the reason why I recommend doing this earlier versus later is, if you can have everything negotiated and agreed upon by early March. I'm gonna stop sharing this. If you can do it by early March, then that gives the town some time to hold education sessions for employees and do open enrollment meetings, which is really an important process when you are making a significant plan design change. And it really is very helpful to employees that may fear the worst just because they don't understand what's changing. So it really helps to put people's minds at ease when you can have those enrollment meetings, and we can do them virtually or maybe in person if we get lucky. But that's why I recommend that you adopt it now or at the next meeting, just to give yourself a little bit of breathing space so that Dennis isn't tearing his hair out at open enrollment time. And employees will have time to ask questions and digest it and what have you.
Well, and this timeline also allows us having a known sort of for the budget in early March, which allows us to get that in time for the final votes from FinCom and ready for town meeting. So if there are savings, it can be reflective in the budget, and we might not have to take as many cuts in other places in the budget.
Absolutely.
And Jill, where this isn't your first rodeo, you or Sue, I mean, do you have a general frequently asked questions list that you could provide that maybe could be handed out and maybe quell some of the fears to the employees that might be facing these plan changes?
I don't personally, because every community
is different.
Different changes.
Mhm.
And, it really is dependent on what the town is going to decide to propose.
Mhm.
But, that's something that I can work on when you guys make that decision of what you'd like to propose. We can work together with Maya and help you come up with a Q&A.
Okay.
Yeah, probably the biggest question you would have is adding a deductible to the plan.
Right.
So that there are definitely education pieces that can be presented to explain how the deductible works in conjunction with the co-payments.
Right. Or the biggest question is, I pay $80 now. What am I going to pay next week?
Right.
Type of thing.
Right. And we can put scenarios together. So for example, saying if on July 2nd, you ended up in the emergency room,
right,
out of that $1,000 bill, what goes towards your deductible? What's the copay, et cetera, et cetera.
Okay. Yeah, that would help. Thank you.
When is normal open enrollment for the employees?
Start April 15th, May 1st.
I think it's in May. Dennis, you're on mute,
May-
but I think
May,
I
yeah,
think
it
it's
starts
in
at the beginning of May.
In May.
Any other questions?
No, this was great. Extremely thorough. Thank you.
Oh, good. I'm
Yep.
glad
Thanks.
it was helpful. And if you have any other questions prior to the 21st, send them to me in an email. I'm happy to clarify anything.
Through the chair, I would ask the board to take a vote as to whether or not you'd like this to be on your next agenda and whether you intend to vote on this. That way I can prepare the notices with Jill and we can get them out to the units and to the retired state, county and municipal employees association.
Yeah,
Absolutely.
I think
I would move to put it on the agenda next week
okay.
Agreed.
to vote on it.
Yep.
Okay, do we take a vote? E5.
Stone Eye.
Hawkins, aye. I wonder if it might help the conversation a little bit if the three of us on the board email Margaret our sort of thoughts of what of the, in some respects, three benchmark versions. I think 1, 2, and 4, because I think as Jill pointed out, 3 is not really a great viable option. Are we just leaning towards? I wouldn't make that our sort of final vote, but if like all three of us are leaning towards the same direction, it might mean that the conversation could go
A lot quicker.
faster
Either
than
that
if all three of us.
we could either do Margaret or
Margaret has something. Yep.
go
Yeah,
ahead.
so next week is just to accept 32B sections 21 through 23. So you don't
Right.
have to, we don't have to jump on that yet, but yes,
Right.
if you'd like to
Or we could
start sending me your thoughts, that's fine.
Right, because we have to decide by January 11th, it looks like. So that's not, that again is 3 weeks sort of from now. And so get a sense even from the start, and it could be that even that week we discuss it, because if we're at 3 different spots, it could be a very difficult and longer conversation. If all three of us our guts are the same direction, then it could be a much faster conversation.
Well, either that or why don't we have the discussion about
Yep.
which way we're leaning at the next
Yep.
meeting?
Yeah,
It works.
and certainly if you're going to be discussing which plan you're leaning towards, that probably should be done in an executive session.
If it can be.
Mhm.
Yeah, that's a good point, Sue. I would say as soon as this is put on the agenda, there will be many more eyes watching.
Right.
Yeah, obviously the vote has to be taken in public session, but to have a discussion about what you're going to negotiate, that should be done in executive session.
Okay.
All right.
All right.
Well, why don't we figure that out on Thursday, Margaret, when we do agenda setting?
That sounds good. And in the meantime, Jill, could you please send me the template that you use for that notice and I can start preparing it? And I also saw that I need to prepare certifications of hand delivery. I expect to hand deliver these.
Okay, no problem. I can help you with that tomorrow.
Okay. Okay. Thank you.
Okay. Anything else?
No, well done. Thank you again.
Thanks.
Sad that we have to give those 2-day notices, or we could have probably taken a vote tonight.
We're fine.
Yeah. Okay.
Okay, thank you, everybody.
Thank you so
Great.
much.
Thank
for
you.
the
Have a great night.
Thank you
Thank you,
very
Jill.
much.
Thank
This
you,
is
Sue.
great.
See you
Good
next
night.
Bye-bye.
All righty. I guess we can move on to our town administrator report.
Okay. The first thing I would like to ask the board is to actually take some action on one item. The special legislation that was sent to the governor's office to submit on behalf of the town has come back. They've had their legal staff review it and redline it. And I would like the board's support of the edits that the governor's office legal division made. I support the changes. I think the changes look good. Did you all have a chance to look at them?
Yes. What exactly did they change?
So they changed, they just struck through a few things. They changed, they took out the
His
chief's
name.
name in the second line. They took out the the acronym for emergency medical services. They added a section, instead of saying beyond the age of 65, they added a section until May 5th, 2026, the date of his retirement, or the date on which he's relieved of his duties by the select board, whichever occurs first.
Right.
They struck the last sentence in that first section, and they struck a few things. They made a few red lines in section 2, not hugely substantive, and then they struck section
4,
section 4. Yes.
Yep.
So
and they changed section 3
Yeah.
to 2.
they're prepared. I think they're prepared to file this right away. I told him that I'd present it to my board. So.
I only saw the final version and it looked fine to me. So I just was curious what exactly was changed.
Yeah, no, it's in there. It's in the TA report. If you go in, it's the lovely pink one.
Oh, okay. I just read the attachment on the email.
Yeah, no, it's there. But yeah, it's nothing like, oh my God.
Yeah,
No.
no, it keeps the substance intact, I think.
Yes. So questions or comments, or do you ready to take a vote?
Let's take a vote.
We're ready to take a vote.
So make a motion.
I move we accept the state's redlining of the special legislation for the police fire chief.
Seconded.
Okay. We'll take a vote. Keefe, aye.
Stone eye.
Hawkins, aye.
Wonderful. I'll notify him right away. The next thing I have, and I want to mention this right at the start of my report, so in case people are watching still, it could get late. It's going to get late. So out of our coronavirus relief funds this year, we have allocated $5,000 for free meal or grocery delivery, modeled on Council on Aging activities to vulnerable Berlin residents, including seniors and others, during COVID. So the Council on Aging Director Victoria Flynn has been working with the food pantry, Berlin Seniors, Northbrook Village, Wheat, and Riverbridge Apartments, and others to touch base with people to see if they are interested in receiving a free meal delivery the last week in December. And so as of the other day, she already had nearly 100 people signed up for this. So she needs to know, she needs a call from anyone interested by Friday, December 18th at 978-838-2750 if they would like a free meal delivered to their house the last week in December. This is a great opportunity for folks to receive something from the town, something that maybe brightens their day around the holidays. So if anyone is interested in receiving that free meal, please call Victoria by this Friday, December 18th.
Margaret, is that something that we can push out to our town page, or, are we risking that?
It's on it. I think it's been shared on our Facebook. It's on Council on Aging's Facebook.
Okay.
I think it's on our website too, right, Mary? Yep, it's up on our website. It's, I don't know where she put it in other places too. I can't tell you, but it certainly can be shared.
Okay.
However, there's going to be a tipping point at which we know, we can't possibly handle anymore. So I would say get your calls in early. Okay. And I know this is also happening through the calls that are going out to seniors as well. So folks are being, as the calls are going out, when people are talking to seniors on these calls, they're also asking them if they'd like that. That's my understanding. Plastic bag ban. The bylaw, we sent notices. Thank you very much, Mary. Mary prepared the whole, the notice for businesses. June Miller stuffed them and mailed them to our businesses, notifying them that there would be, the bylaw would be effective on January 1st. As you know, the bylaw actually became effective on November 1st, but because we heard from the Attorney General 2 weeks prior to that, there was absolutely no way we could tell businesses that it was going to be effective 2 weeks after the fact. So businesses have been notified. We have heard from one in town saying that they just stocked up on a supply of plastic bags and could they be grandfathered. I don't know that there's any grandfathering in here. However, I emailed her back and said, look, we understand that during this particular time, it's difficult. It's going to take a while to transition. I'm certainly not going to be out enforcing the bylaw right on January 1st. However, the bylaw does require the board to establish a process by which the enforcement of this bylaw is done through other duties. So I'm guessing through, our local inspectors. If they go out, they should be reviewing whether or not a business is compliant. So in the next couple of weeks, I'm going to have to ask the board to determine this process, maybe in your next meeting, to determine the process to be followed. You're also going to have to identify who the non-criminal disposition enforcing authorities are under the bylaw. So you'll identify who's going to do it and who is going to be the enforcing authorities. So I'll ask the board to do that in the next couple of weeks. Otherwise, we are not going to be, I know I'm one of the enforcing authorities under the bylaw. I'm not going to be going out and cracking the whip on January 1.
I would love to find a way to sort of slowly roll this out. I read that letter. I think even if we receive just one, there are other businesses who, because of COVID, just trying to stay afloat, are not like watching bylaws passing at town meetings in the town of Berlin, especially some of those that are at the mall that might not even realize they're in the town of Berlin. And so to find a way to be nice to these businesses and give several months to get it over, I'd love to be able to find a solution for that.
Yep.
Margaret, do we
would
know what
too.
other towns are doing? Because didn't Hudson do the plastic ban bag as well?
They did, but that's already effective in Hudson. So they've got it up and running. Yeah,
And Marlboro?
Hudson.
Marlboro, no. Marlboro does not have I don't believe Marlboro has a plastic bag ban. I only know that because I went to a store and
Right.
forgot my reusable bag and got plastic bags.
Just that
And that was only
that definitely might have some issues over the Solomon Pond Mall where
Yeah.
there could be a business that's partially in Berlin and partially not.
Well, there you go. Scott, I couldn't agree more. I think, given COVID, given the, the timing around the holidays, the fact that some businesses may have stocked up on plastic bags, there does need to be a period of transition here, I think.
Yeah, I agree.
So anyway, that'll come before the board and you can determine the process under the bylaw. The next item is Barnes Hill Road, storm drain, Richard Drive. The surveyor came for the highway department, marked the edge of the public way, and I have sent a response to the resident on behalf of the town regarding this matter.
And are we still, or I assume that we're not doing the camera thing we talked about?
We are not doing that at this time. A letter has been sent, which has indicated that the town is going to remain in the town's jurisdiction is the public way, and that's where the town is going to remain.
Okay.
or keep its focus. Okay. I'm actually working my way backwards through my report today. External communications protocol. So we've heard several times about the coordination of communications for the town. Now, understanding that we do have limited staffing capacity, we are going to try to develop an external communications protocol that will be something like, if there's a message that goes up on news, it's also going to go here, here, and here. Mm-hmm. So we're going to develop a protocol that will try to keep consistent communications going out through press releases, through cable mm-hmm. access TV, the bulletin board, through the Powder House News, social media, website, et cetera, et cetera. Obviously, there are going to be some meetings, a meeting like a regular board meeting, we might have fewer channels of this communication, but with a community forum, we might do, the full extent of the external communications. So I'll draw up something and present it to the board for your consideration, or for an introduction to the board at your next meeting.
I mean, I think something based on some of the stuff I heard at the coffee talk, I think something even as simple as here's just a list of places you could put things when doing broad announcements. And I think a lot of people doing events and things they want people to know about, like, oh, I forgot the item, or the shoot, there's another one, Acted Unlimited or something like that, that of places to go, and that just hopefully will help get word out there.
Yeah, if we can prepare an outline, and actually I would recommend that once an outline is prepared, that somehow we plug this into the board and committee handbook as it's worked on. The shared streets and spaces, we still are accepting comments on the pilot project. Comments will be accepted until this Friday, December 18th. I mentioned at the shared, maybe open, I'm getting my meetings confused now, coffee talk or shared streets and spaces community feedback session. I mentioned that MassDOT is allowing us to buy the 3 benches that were originally requested as part of the pilot project. And I suggested that we get that out to the public. We're not going to have a lot of time for the public to cast all kinds of votes over weeks, but if we can get 2 bench options and get people to respond in 1 week's time as to which benches they'd prefer, then maybe we can do that. So let's see if we can find a couple of attractive benches, put it out there for people just to say, oh, I like that one, or I like that one. And if you like neither, you don't even have to respond. So, all right. And the next thing I have is the board met in executive session on Thursday regarding a voluntary recognition clause for the fire department union. The union has agreed to the version that was voted by the board. So there is mutual agreement on the voluntary recognition clause. Next steps will be to begin an outline and to start negotiations. Finally, the states, have I hit everything? I hope. Let me make sure. Yes. Finally, the state has issued order number 58. Yes, that's order number 58 for the COVID pandemic. and this is now a return to phase 3, step 1 for all communities. So I have links in my town administrator report to the orders that have been issued. The return to phase 3, step 1. And its companion order number 57, regulating gatherings in the Commonwealth, both reflect reductions in the allowable numbers of people at gatherings, both indoor and outdoor, and both public and private gatherings. So folks are really encouraged to pay attention to those and to continue to be as vigilant as possible. That's all I have for tonight. And my TA report will be up online, so you see the whole thing.
Okay, questions for Margaret? You answered
Well,
mine.
that's good.
Your report just answered mine, so I'm good.
Okay, okay.
Okay, then we're going to move on to the Personnel Committee's revised recommendation on fiscal year 2021 market rate adjustment and requests for contingency line funding. Jeez. Okay. So Margaret, are you?
Claire Pond and Sue Terrian are both here.
Oh, okay.
Hey, Sue. Hi, Claire.
Hi, Claire.
Claire, you're on mute.
I'm sorry. I just got in the door and Sue's gonna do the talking for us, so thank you, Sue.
I'm trying.
Oh, now, Sue, you went on mute.
Am I now?
No, you're good now.
There we go.
I need a course in computers. Then I guess I'll just let you people know that we did meet December 2nd. We took into consideration your comments, talked amongst ourselves, and we decided to withdraw the 2 salaried employees. So we are keeping our request for the line item for all the other employees. The total now will be $4,824. And that's until the end of this fiscal year or June 30th, 2021.
So these are changes to be effective January 1st, the last 6 months of this year. And the impact's only like $8,000 then for fiscal year 22.
I'd like to say yes, but we also still have the final report coming from the HR. So there's still a lot of there's a lot of information still coming in to be considered.
Right. So for these changes, the impact is for 8,000, but there could still be other changes to go. There's at least one
Correct.
salary employee that you said you're even on the spreadsheet, you say you're still looking at gathering data on.
Correct.
Right.
Questions?
The cost impact, through the chair, the cost impact for the last 6 months of this year, as Sue said, would be 4824 for the employees that are listed. I think June is still doing a final review of these. But I also believe that this is in the form of a request for the contingency transfer in that amount. Is that correct, Claire and Sue?
Yeah.
Correct.
Okay.
I am fine with a motion, or so it would move 4824 from the contingency line item for increases and raises as outlined by the personnel committee and their proposal, their second proposal.
I will second that.
These are market rate adjustments, so we just.
Mhm.
Yes, market. Yep.
Okay, so can you tell me remind me what the balance is now in the contingency fund?
It's $33,000.
Okay. All right.
So
go
if
ahead.
we don't use it, where does that money go? Does it
The
just
money
sit?
goes right back to the general fund and it reverts to free cash next year.
Right, like any unspent line item.
Yep.
Yes, yep.
Okay. I personally I liked your first proposal. I guess I was outnumbered. But we will call for a vote. Got a motion and a second. So we'll take a vote. Keith, no.
Stone Eye.
Hawkins, aye.
Okay. Motion passes.
Thank you, Susan and Claire, as always. Appreciate
And
everything
Chris.
that you do. And Chris and June
Yep,
and everyone
yep.
else in that pot.
Chris, those 2 positions may also be some that after we get the information from HR, we come back again. We just haven't got the final information.
I mean, as we said last time, I'm not a fan of those others, but I also do not believe that I'm closing the door on any more proposals as we look at this further.
Right.
Okay.
Good.
All right. Well, we look forward to hearing back from you again.
And they also have the COLA recommendation.
The COLA, we are staying with our 2% recommendation. We did look at several other small towns in Massachusetts, and they ranged between 1.3 and up to 2.5. So we feel that we're being fair fair and equal to other small towns. So we're going to stay with our 2% recommendation.
We
Okay.
didn't do COLA this year, right?
No.
We did not. They did not get a COLA this year.
Right. Okay. Any other? Go ahead.
I mean, I still see that Boston, Cambridge is 0.6 and the Northeast region is 1.2 and Worcester is 1. I think 2 is generous. But I think you have the votes for 2 and I don't feel strongly enough to make a stink about it.
What was the, through the chair, may I ask, Claire and Sue, what was the recommended COLA for the current year was 1.5, correct?
That's
And
right,
that had to be dropped when the budget was reduced. Okay,
right.
okay.
I think one of our thoughts was that we want to try and do what we could if we can, and if the town, if it's financially feasible, in that we don't want to get too far behind either. And that's the whole reason behind this whole market piece as well.
Yes, and I
No.
think we are thinking about changes to health insurance and that kind of thing.
Right.
You know, that's it just could be too much, you know,
Right.
if you reduce the COLA. So I agree with the 2%.
Okay.
Okay, do I hear a motion on the cost of living?
I make a motion to go with the Personnel Committee recommended 2% for cost of living increase.
And I can second that if you like.
I have no problem seconding it because I think we should vote on it.
Yeah. Okay, then we'll call for a vote. Keefe, aye.
Stone Eye.
Hawkins, no.
Okay. Is there anything else? I think we're good.
That's it.
That's
So-
good. Thanks.
So quick question before you ladies go, even though we've said yes, you still need to go through finance, correct? Does finance have the opportunity to say, no, too high and kick it back?
They have in the past, so yes.
Okay, so I mean, even though we're saying 2 now, it's not solid, drawn in concrete,
Right.
it's a line in the sand, it is potentially still up for discussion,
Right.
Yes.
Correct.
given all the other budgets, okay.
Okay. Well, I thank you too.
Thank you, ladies,
Thanks.
appreciate it,
Thank you,
lovely to
Claire.
see you.
Thank you, Sue.
Thank
a lot.
you.
See you Wednesday.
All right. We're gonna review next our board's fiscal year 2021 goals and objectives.
Yay!
Yay.
Let's put those up. Let's put them up. Mary, do you happen to have those on your drive that you could? I'm afraid my drive won't. Well, let me see what I got. No, I don't have my drive up.
Somebody had them last week.
Mary's in
I
the
did. I
minutes,
had them
'cause
readily
I can see
available
she and I have
last
them
week.
open.
Here we go.
There you go.
We need that.
All right. So again, as we talked about, I went through Chris's color-coded list and just kind of picked them out as to where we were. If anything, this is to keep all of us honest as to where we are, what we're doing, who's driving, what needs to be done, roadblocks, bumps, etc., where it could be. So I don't know if we can, probably put this in a drive somewhere that all 3 of us can have accessibility to and just go through and update. So it's, maybe it's not every week we talk about it, but maybe it's at least once a month we pull it up and, see where we are. And some we're going to need help from, like on the 40B stuff, it may sit for a while, and Bullard House may sit, for a while until we can talk to historical and other things, but at least, have this moving and a shaking.
Well, even as long as it continues, even, should July 1 come along, that doesn't mean that we're going to write them off and say, oh, well, we didn't do them.
Correct. Correct.
We'll just continue.
Right.
One of the things I was just going to add is that there is a committee to review the River Bridge agreement. Is that true? Yes.
It's a working group.
Yes. And so I think we've met once or twice. And then probably we'll be meeting again soon. I don't know if you wanted to.
Oh, absolutely. I don't, is it on there? Mary, can you scroll down? Por favor.
Yeah, it's a blank line on it.
Oop.
Oh, no,
Whoops. Oh, there.
it says,
Nope,
it
there it is.
says
Okay.
River Ridge Agreement. Yep.
All right.
So
I
I don't know if you want to just add something about the working committee.
Okay.
We'll meet
Right.
to discuss. I'm guessing probably after the holidays, maybe, or maybe we'll meet once before that.
Okay.
It's got to be soon because we have to talk about the fiscal impact study and then go back to the agreement and the modifications and take a look at those. We should also add, and I don't know if I mentioned this at Coffee Talk, Chris as the board's designee, Tim Wheeler as the planning board designee, and I met with the Sennies to talk about the current public safety mitigation payment that was due on November 1st. We were told that we should expect to hear from them this week with some sort of response on where that will go.
All right. Well, I mean, I sent that around. So Chris, if you want to, take it, find it in your email, take it, update it, send it to Scott and I. Like Scott can be the next one to update it. Scott can then send it to me, and then we can just keep it.
The draft?
Yeah.
Oh,
And then
okay.
this one.
I was just
Yeah.
going to put a few words in the River
Okay.
Bridge review, whatever.
Yeah, no, that's fine. And, and update it as we go along, and we'll just have it circulating for movement.
Okay.
Yep.
And then we can just make
Right,
like a page 2 for closed items. And as, items are complete, they just shift off. So we are not constantly looking at, oh, that one's done, that one's open.
All righty.
Right. And then inventory of software was actually considered a lower priority by everyone. So I'm not working on that. It was the inventory of buildings I did, and we'll go back and look at again.
Right.
We can
Okay.
start figuring out like how best to use them.
Okay.
Yep.
Awesome.
Okay.
And again, if there's ones that I've missed, that was on the list, on the
Yep.
color coded list, please add them. I just wanted to get something
Yep.
up there for Coffee Talk so that
Yep.
we could show the peeps in town what we were working on. And I think personnel, one of the items that personnel is meeting on Wednesday is to talk about potentially restructuring highways. So, that little
Oh, good.
0% could move a wee bit.
So there is a meeting coming up to talk about that?
I know that Dave's coming to the personnel meeting on Wednesday.
Dave's
Oh.
talking to the personnel committee on Wednesday.
Okay. All right. I
Thank you, Mary.
think we're good.
Through the chair.
Yep.
So the board back in February, I want to talk about coordinating the board's goals and the town administrator's goals, maybe in the coming year. Now, of course, I have 3 pages of priorities and objectives that was voted before COVID. But I'd like to periodically, give updates on those, talk about maybe how some of mine tie into these, and so. How would you like me to bring that to the board as far as priorities and objectives on my end? And I'd also like the board's thoughts on come February, when we go through the town administrator's priorities and objectives again. Are we going to go through these all as a coordinated
All as one.
priorities and
Yes.
objectives?
I think we
I
should.
would envision so.
Okay, that's good.
I mean, so Margaret, if you go through your list, are there any of yours that are on our list that maybe you
Yes.
could just,
Yes.
so yeah, then I would just, have ours grow and yours shrink.
Okay.
But I'm saying,
Okay.
but I'm saying like if one of yours was Tolman, the Tolman property, to do something with it, and we already know that's on our radar. I mean, I think that one is probably a combined effort out of all of us and, waiting on additional information. So I wouldn't see that one as just yours, type of thing, or the volunteer guide is not just yours anymore. It's now ours. So, kind of like with 7, you get egg roll. So, yours, mine, and ours, whatever we can do.
I'm more than happy to share.
More than
happy.
Margaret about doing an update on her goals and objectives at some point, whenever she's ready, at a meeting. So, and then we can see, which ones are combined and we're both working on.
That's good.
And there may be some, Margaret, that we said, don't worry about that. Now all of a sudden we're like, oh my God, it's got to come up. Or like Scott was saying, hey, we put it on our list, but then realized with everything that was going on, it quickly fell to the bottom. So it might be time to readjust given COVID and budget, et cetera, what's going on in town.
Right.
Okay. Sounds good.
Okay. The next thing on the agenda is the board and committee handbook.
Suck my will to live. That is all I'm going to say about that handbook. But no, so you all had back and emailed all of you, I don't know, 5:30, something like that, the latest. And Chris, what you were seeing too, so what happened when I was going through and I would do like a global find and replace for like vice. So when it said like vice chair, unfortunately it found the vice in service and it kicked that up, to like,
well, there's more than one. There's
yes.
more than one. And no, when I mean service, there was more than one. And I only highlighted one.
I went through,
one.
I went through a bunch of them and found them. So, and that was
still found another one.
Yep. So, I went through like the committees, some needed a apostrophe S, some just needed committee. There was some, grammar changes too that I found on tonight's latest version. So I think we're getting close. I'm hoping that this version is closer than what it has been. So maybe this one can go one more round, that you have, and then we put it up online and we let the other boards take a look at it. And then we come back and do a revision. And we're always going to find stuff, with that.
So one of us should go through maybe with all the changes accepted and see, then you can see where the grammar and the spelling errors are.
The one that you have now, I have accepted all changes. So your changes, Margaret's changes, I accepted everybody's. And then I went through and I changed spaces and I updated the table of contents. So the version that you have tonight that I emailed back is accept all changes. So if you want to take that one and then start from there and see what else we have, then that would be great.
So, okay. Am I volunteering for this?
Oh yeah, because you are like the queen of spelling and grammar and punctuation. Oh,
right.
Yeah.
I would never catch any spelling, grammar, or punctuation.
I had a few.
I'd create more.
Excuse me, through the chair, I had a few responses to new questions that were in last night's draft, but I didn't get my responses done till late today. And they're all on page 12. So it's not like they're all over the place. So I'll get them to you.
All right. So yeah, Chris, since you're our grammar queen, can you take a look at, tonight's version and go through and see what else we can find? But that's what it was, is that, to capitalize vice, it got Sir Vice, in it. Mm-hmm.
Yeah, I don't think the V in the middle of service needs to be capitalized.
No, and as I said, I went through tonight and tried to catch as many as I could find. So I'm sure there's probably a couple that I whizzed through and missed, but I mean, the quicker that we can get this out there and get it up and have folks start to look at it, then, that is, here's our foot in the sand of, here's our first pass at the volunteer guide.
All right, I'll do my best.
Yeah, the bomb.
Thanks. All righty. Is there anything else on the handbook? Oh, I know what I was going to ask is In order to, I know one of the goals that we did have that fell to the bottom, I guess, but it was to encourage better communication between boards. I was going to suggest that boards be encouraged to send their draft minutes to other boards and committees, like planning board to ZBA, Board of Health to ZBA, or Conservation Commission. Sometimes they don't keep each other in the loop. If they just sent their draft minutes, not just says draft at the top. So if it was something pertinent to what they knew that, like ZBA knew planning board was working on, or vice versa, or I wondered if that might be something that we could add to the handbook. That might solve or
Chris,
help.
and their agendas too, the agendas and
Right.
minutes.
Right. A specific, I mean, especially if there's something that both boards are working together on.
Well, and the reverse is that if you're on one board, potentially subscribing to the agendas to other boards that might be relevant to you, so that you can just quickly see them in advance and go, wait a minute, we voted on that a different way. Why is it on your agenda? And we can talk about it. Or it's going to come to us, and so maybe I want to go to your meeting. So by the time it comes to our committee, it does. I've subscribed to several different ones. I've not made them, but I get to see the agendas and at least get a sense of what's
But
going on.
sometimes by the time the minutes are up on like My Town Government,
Right.
too late,
Right.
Oh yeah, I agree that on the minutes, but agenda setting, you can get the agendas.
Oh yeah, I do too. I subscribe to a few of them.
Yep.
So I don't know if I can figure out some language, or maybe I'll ask Margaret.
I can help.
Okay. All right.
It could be with a little bit of coordination. We try to make sure that between the three of us, we're subscribed to all of them.
Right. I try to put even the like the Zoom link to some of them in case I might tune in.
Right.
Yep.
on my calendar.
Yep.
So okay. Well, that was the only other thing I guess I almost forgot to say. So we'll move on to new business and approval of calendar year 2021 license renewal. Yeah. We have how many?
You have 5 total, and that includes the Cabela's motor vehicle class 1 that was put in the packet today. So you have 3 common vic, 1 class 3, and 1 class 1.
Okay. Any questions?
No, they all look fine to me.
Do you, I hear a motion?
I move to approve the 5 licenses renewals in our packet.
Seconded.
I was gonna call them on.
Okay. Then we'll take a vote. Keefe, aye.
Stone Eye.
Hawkins, aye.
That's a unanimous. And then we have the
Yay.
liquor license transfer applicant who would like to waive the Corey. And this is for incoming owners, officers, directors of Fridays.
Is that common?
Is that common?
Yeah, is that common to waive the Corey check, the Corey background check?
Go ahead,
through the
Mark.
Chair, no.
So
Certainly, and certainly establishments can try, but my recommendation is don't waive it in the interest of the town.
So let me understand that this is the owners of TGI Fridays International. So these board members are potentially people who have actually never even been in the United States. They need to do a Massachusetts criminal background check.
Yes, a Massachusetts criminal records background check. Yes, and a triple I. That's the nationwide check. Yes. The board's.
Go ahead.
The board established liquor license guidelines or rules and regs. And the board has also been through some interesting situations with local establishments that really do reinforce the need to stand by the background check protocols that have been put in place. And that is why my recommendation is to require this in the licenses. Now, the other thing is that the attorney representing TGI Fridays, Inc. Essentially said, it's good enough that we had the ABCC run these. However, the ABCC allows local licensing authorities the ability to run their own Cory checks. So local licensing authorities know that the establishments operating in their municipalities have principles that are in good standing legally. So again, my recommendation
So the
is,
state has already run this, and we're going to ask them to run it again. Again, for people who might have potentially never have been in the United States, because this is an international company with 850 franchise locations. It just seems silly to me.
Well,
Now, I'm trying to figure out where I would draw the line, because if it's a mom and pop spot, and I hate to have mom and pop places do more work than we have international businesses do things, but so where is owners? If it's a publicly traded company, that means that every shareholder of the company needs to run a Cory check?
the principals of the company need to have Cory check. The executive officers
Okay.
of the company need to have this done.
and we have,
And Mary just clarified that ABCC only runs the Massachusetts Cory, not the III, the nationwide background check.
I don't know, to me, given the giant sandwich we avoided at a local establishment, I hesitate to skip anything and potentially have the town of Berlin end up in any type of unforeseen litigation that could have been easily avoided if we had just taken 10 minutes to run a Cory check, regardless if they're living in the US, working in the US, don't care. If it's a business that's in the town of Berlin, then to me, we have a right to protect the town of Berlin.
Right, but you get that running a database check of Massachusetts criminal background check on someone who's never been in Massachusetts will always come back blank, because they've never been in Massachusetts, even if they've committed criminal crimes.
now, how do you know they don't live in Massachusetts, though? You don't.
I don't. I'm thinking of going to the site that says they're in 55 different countries.
Yeah.
And that that potentially, again, they might have been in Massachusetts. They might have a speeding ticket here. I don't know, but
What if
Oh.
we waive this for this one, and then someone else wants it waived too?
I would look to it again based on where I think those people are. I might be willing to waive that as well. I also think that every time we've come across these liquor license stuff, I have had objections to the amount of work we put businesses through for no potential benefit to the town.
Well, like Peg said, we could have avoided some real problems with a certain restaurant in town.
I disagree with that assessment, but that there's no reason to go down that path tonight. That the town went, well, I don't want to go down that path. And so we could decide to vote. I think it is silly to make a large international company to have people to try to do things to satisfy our town. They've already satisfied the state.
Mary had her hand up, and I know right now she's chewing on something. Of course, that's when I'd say Mary had her hand up. There you go, Apple.
Yep.
Okay. To say that they're in, X many countries, it's like McDonald's is in X many countries, or Dunkin' Donuts. They're franchised. And so this isn't TGI Fridays International doesn't exist. This is one group owner of X many TGI Fridays. One. And
which
two,
was a fairly substantial number when I read it.
This company may own a substantial number, but they're not the organizational juggernaut known as TGI Fridays. That doesn't exist. They're separate. It's a name that's licensed. It's a marketing thing that you buy into, and they own X many. This lawyer has kind of danced around this since June. We've asked him repeatedly since June to follow our liquor license policy. He's provided a Cory only for the store manager But what he provides to the state of Massachusetts is Corey forms for all of the owners and managers, the corporate level. He's refusing to provide that corporate level information to us for us to do a Corey and a triple I. Not only do many Massachusetts cities and towns do it, but when we asked the ABCC if it is our right to do it, they said yes. Ryan Melville is the licensing manager.
I agreed it's our right to do it.
No, but there's a reason
I
why.
do
It's
not-
because an alcohol licensee is completely different than a common vic. It is liquor. And, and so you have the right to do a higher degree of background check on when you're talking about liquor licensing. And that's why most cities and towns do their own background check, and many do a triple I beyond just a Corey. So it's not frivolous, and it's an international company, like you say. Increasingly, these liquor license holders are not locals anymore. Increasingly, liquor licenses are held by multi-state organizations.
Mary, if I could just add that TGI Fridays Inc. is actually a registered Massachusetts corporation. So
But they're out of Texas.
They're
They
out of
formed
Texas,
a
but they-
corporation for the purpose of this purchase back. He's also claiming that this is the same TGI Fridays corporation that Berlin had licensed in 2014, when that's actually not correct. It was not TGI's Incorporated. The prior licensees in Berlin was something called Heath Corporation of Marlborough, with no overlapping officers and managers. Now, he persists in saying that there's overlapping ownership from the past, but we don't see it in our records. So when the state gave some kind of blanket group blessing to 10 TGI locations in the state of Massachusetts, it did not include Heath Corporation of Marlborough as a prior owner. So,
Well, all right, so thank you, Mary, that's helpful. The matter before the board is, does it want to waive the requirements that are set forth in its own license rules and regs?
Okay. Do I hear a motion?
We don't actually have to take a motion. By taking no action, we're not granting them the exemption, correct?
No, they've requested a waiver. You actually need to deny the waiver.
So we either have to vote to deny the waiver or support Margaret's recommendation.
6 of one, half dozen of the other, that's correct.
Yep. I'll make the motion. to
I
Deny
was
the.
gonna say, they're both the same, right?
They are both the same.
I'll make the motion to deny the waiver. Do I hear a second?
Seconded.
Okay. Are there any other comments or questions before we take the vote? Okay, then we'll take the vote. And I will vote Keefe, aye.
Stone eye.
Hawkins, aye.
Okay, that's unanimous. Good discussion, though. So let's see, we're down to discuss the proposed fiscal year 2022 appropriation for the food pantry, the Berlin Food Pantry.
Through the chair, this was one of the board's identified priorities and objectives, funding for the food pantry. And so Mary put together the existing lease agreement. It's a one-page document that allows the food pantry to rent for $1. Is this an annual payment, Mary? $1? For the rental of space, utilities, and security access. So all of that is provided for $1. And I think that was done not only to show that there is actually an agreement in place for the lease, and there is actually a notation in the agreement that this is to provide services to Berlin residents, but also to show it against the assessment that is paid, or the donation that is paid to Wheat every year as well. So because we're doing the budget work now, we're developing an FY22 budget, now would be the time to determine whether or not the board wants to request funding for an assessment to the Berlin Family Food Pantry.
Is
I thought that wasn't possible. If it is possible, then great. I thought
Well,
when there were some more machinations we'd have to go through to make that happen.
Well, there is an agreement in place for the lease. I think all we really need to do is expand on that and make sure that it's filed with the accountants with the accountant for the auditor's reference. But you can go ahead and discuss, you can certainly go ahead and discuss a donation, which is what we would call an assessment here. So.
Right.
So how
I
do
mean,
you
I was
this?
in a perfect sort of universe. I'd love to be able to rename the line of the budget that says wheat to sort of, support for Berlin families in need, although something shorter than that, otherwise our spreadsheet would be 6 miles long, and increase that dollar amount. Well, I don't have a dollar amount in my brain that's a magic number, but increase that dollar amount substantially that would allow us to do other things that potentially could help out Berlin families in need. And that, supporting a food pantry in town would be one of those things we could do. Supporting wheat would be one of those things I'd want us to continue to do. But there could be, as time goes on, other needs that we want to use to help Berlin families need. I wouldn't do that for 2022, but I'd like to make that line so it could expand into other areas as we saw other things to do. We could decide we want to pay internet for all school-age kids or something like that, where there's a need, or rental assistance or mortgage assistance. But for 2022, increasing it to like 7,500 or 10,000, where maybe not even all of it that new money goes to the food pantry. Some might go to wheat, some might go to yet to be identified stuff.
So I don't see any reason why the name of the account couldn't change, but what we would need is, from the financial perspective, what we would need is we would need set assessments within that line. And we need to call it assessments.
Yep.
To those organizations,
Yep. And we can do to the organization, because I again thought we would end up having to do like, X dollars goes to wheat and Y goes to a food pantry service in Berlin, and that we could do an RFP for a food service in Berlin that in theory, the Berlin food pantry would be the one who would provide the way to do it, and we could get it to them that way. But we can sort of do a direct assessment to organization providing services already in this town.
yes, we can do a direct assessment. The whole discussion about agreements, we have to make sure that the agreements are in place before any assessments were paid, but yeah.
Right.
And do we really know how many Berlin families that wheat assists?
I don't know if they provided the service levels, but I'm certain they can, so we can find that out.
So my feeling on this is that I would love to do this. I mean, I think it's a great idea, but I'm not so sure that this is the year to do it. We're talking about changing the cost of health insurance possibly to go up for employees. We've taken a hard stand on market wage adjustments. I'm just not sure this is the right year to do this.
See, I think of COVID, this is the perfect year to do it. And we have a $15 million town budget. If we can't find $2,000 to help out Berlin families in need, I just don't know what the purpose of a lot of the stuff we're doing is. And you're right, I'm just as hard on some of those other things, that when it comes to the health insurance stuff and trying to figure out why retirement services goes up 10 to 15% every single year, and other things. But I definitely think we need to find a couple $1,000s to help out Berlin families in need.
Yeah, no, I'm in total agreement. If, this is the year, 2020 has been a crap year for everybody. You read the reports that come from the food pantry that there's more and more people that are coming to the pantry to be helped. So yeah, I agree with Scott with the budget that we have for this town. If there's something that's shiny and bright and new that we have to say no on, and we can go to bed at night knowing that we've helped 1, 2, 3, 4, 5 families, I'm all for it. So I think this is the year that we need to help.
I agree that, COVID has been a tough year for everyone. Um, And I hope we don't want to have a reputation for going for shiny and new.
No, and I understand that, but when I say shiny and new, I mean, everyone, it has been my concern for years is that people will say, oh, look, we need to buy this instead of, oh, how can we retrofit it? Well, let's just go buy something new. So, this is the time to push back. It's kind of like, where Margaret stepped up last year and, gave back her increase. And honestly, that I think forced a couple other people's hands to step up as well and give back their increase. So, it's this is what we were voted into office to do, is to take care of the town and to take care of the people in the town. And yeah,
Right.
this is our time to shine.
agree.
So,
I'm not disagreeing with anything you say.
mhm.
I'm just wondering if we have tight reins on some things, and then we're going to go and do this. So I'm just trying to make sense of it all.
Mhm. I don't think a couple grand out of a multi-million-dollar budget is going to break the town of Berlin. I
And-
truly don't.
Well, I mean, we did have some
Eh.
money planned for the market adjustment too. It was in the contingency fund, and we
Right.
didn't do that.
Mhm.
So I'm just trying to make sense of, and if we keep saying that, the more you say something about how we have to say no to shiny and new, the more we're going to get a reputation for that. So,
But to me,
we
personally,
don't do
I'm
this.
okay with that. I would rather have the reputation of somebody coming forward and trying to say, we need X, Y, and Z. And, my response is going to be, show me, show me, show me the proof that you need X, Y, and Z. And so if we have to say no, we have
Right.
to say no. I'd rather be the person to say no to something shiny and new than to say no to helping residents of the town.
You're missing my point. If you keep saying
Uh,
that we're going to have to say no to
Right.
shiny and new, and that people come to us and ask for those shiny new things, then people are going to think that's true. And I don't think so. I think, we're trying to be very frugal about how we decide how to spend money.
Right.
So-
And I frankly believe that sometimes being frugal is buying shiny and new, because sometimes buying
Exactly.
a used something or other every 3 years is way more expensive than buying a new thing every 10 years.
Right.
Not in all cases, and it all depends on how much you use it and what it's for. I often tell stories about how expensive it is to be poor, because you buy $10 sneakers that wear it every year instead of $30 sneakers that would last you 5,
And
and
too. The duct tape
right.
that goes around the
And so, right. And so, I mean, I've looked at some of the capital requests, and I might have some serious concerns about some of the capital requests. Now, I'm believing that some of them might disappear before they even get to our level. So, I don't feel the need to jump in too heavily. But I'm going to get that. We spend $4 million on a highway barn that doesn't meet the one thing we bought it for. And so what someone did is cut corners, and they cut corners. They ended up spending a ton of money on something that doesn't meet the need.
I know.
And I will be dogged if we ever get by something like that again. I'd
Right.
rather kill a project and start again from scratch than spend a ton of money on something that doesn't meet the one thing. It's like if we built the elevator but didn't put a door on the second floor. Yes, we built an elevator in 1870 Town Hall, but nobody could use it. But the elevator's now there. We spent $1 million. If you have one goal for something, you should make sure that one goal gets accomplished with the money we give you.
Okay. So
Through the chair, so should the board decide to submit a request for an assessment to the Berlin Family Food Pantry effective in FY22, the one thing I do ask that you take into consideration is the lease agreement, the $1 lease agreement that's already in place. So not only
Right.
that.
So we're already providing some support. Yep.
Yeah.
oh yeah.
I'd almost want to see if we could reach out to the food pantry to have them suggest what they think would really be useful and helpful from a donation size. I don't want us funding them fully. I think they have some great donors. I want them to continue to fundraise because again, I don't think I don't want this burden to fall totally on us. And maybe it's something we can give them a matching grant so that they can use that as a fundraising effort to to expand their fundraising from alternate sources and donors.
I'm just a little worried we're opening a can of worms here too.
I would suggest that if the board is interested in is submitting a request for an assessment effective in FY22, that a number be determined, taking into account, of course, the support that's already being provided to the food pantry. That's my suggestion at this point. And again,
Margaret,
it's an
could you
assessment.
is there any way I could get a copy of what their current, like what their fiscal year 21 budget is? We have the weeds budget. I get a sense of their size and sort of
We could ask.
that, but when I'm thinking of a donation to them, I don't want something that is out of line.
We could ask them for that information.
And we
yes.
have some time to make this decision, correct?
In fact, yes. In fairness, yes, that's actually a very, very good and reasonable request, because we ask the same of wheat. So you'd certainly want to see that before you do it. Yeah.
Okay. So do we want to perhaps have this on the agenda if there is more information next Monday?
Yes.
Is that a good idea, Scott and Peg?
Could you push it off? Could you push it off 2 weeks? I might not be able to make next Monday's meeting.
Oh, that's
My
right.
attempt is to be back in Massachusetts in time for it.
Okay.
But just in case I can't, could we push it off for 2 weeks?
What is that, the 28th?
28th. Yep.
Okay.
28th, yep.
All right. Okay. Shall we move on? Okay. This is the review of the fiscal year 2022 budget requests and draft working budget document.
Given that it's already 9:36, let's see how we can make it through. So this is going to be for Scott's information. Last year, and you may have followed this last year, Scott, but because this was my first year and I'm responsible now for bringing budget requests to the board for approval before they make their way to the finance committee, I decided it would be probably the most manageable thing to do to present recommendations in phases rather than all at once. So I intend to do the same thing this year. I will date the dates that I make the recommendations tonight. I have 18 of them. And each meeting we'll go through and we'll try to knock off some more of them. Okay. So let's go into, I'll share my screen. Hopefully you can see, it's pretty small. Okay, so what I'd like to do here, I don't know if I can do this. I can't see it all the way. Well, you know what? Can you see the whole thing or no?
The last column, like the TA is smudged
I'm
a
just
little.
all right, I'm gonna.
I see now. Yeah, I can only get as far as AJ,
Okay, so
but
let
that's
me,
because I have people's pictures. And I only have one
that?
screen
Yep.
tonight.
You see it? Okay. Can you see it? All right, I
Yep.
hope you can see it okay. All right, so we're gonna start with the low hanging fruit, similar to what we did last year, on the first round anyway. I say last year, this year, first round this year. All right, so we're gonna start with select board expense. The select board expense line, in the past year, it has changed significantly. Previously, the select board expense line included things, include consulting?
Included Weston and Sampson, included legal? No, not legal.
No, that was, that was legal fees. And I honestly, from last year, there was a significant decrease in this. But what we were able to do with the decrease from the 18,290 to the 8,290 was we were able to shift 10,000 into a new consulting line, because consulting wasn't appropriately captured under legal expenses. And we were able to also reduce the legal expense line and shift additional monies into the consulting line. So, and put the money where it belonged for Weston and Sampson. That said, we're talking about select board expenses right now. This line captures costs such as postage, office supplies, reimbursements for certified letters, reimbursements for administrative assistant cell phone bill, certain small technology costs. Like this year, there was an Adobe purchase. So Mary has submitted the budget. It's been reviewed by the accountant. I've looked at it, and I do believe that level funding, oh, by the way, yes, you know that we've asked for level funding of all budget lines. So level funding is reasonable here. This year so far, only 22.5% of the line has been expended. So this is a line that we could look at as we move forward to see if any further adjustments should be made to it. Last year, hold on one moment, sorry. In FY 20, the line was at $18,290 and was 37.5% expended at the end of the year. So again, this is a line that could be monitored for further savings. The other thing that we have to recognize in the department's expense lines this year is that training is non-existent. Right now, trainings, workshops, there are many things happening remotely, but the in-person training has essentially ceased. So training for certifications, et cetera, that is money not being spent right now. And in addition to that, at the end of, in FY 20, the last quarter of FY 20, we imposed a spending freeze. So we are seeing less than anticipated spending in these lines. Hopefully someday things will go back to normal. Folks will be able to go back and take trainings and workshops like they had before. So anyway, my recommendation on select board expense is keep it level funding or reduce it by the $40 that's been suggested here for this year. Town administrator expenses, this line I am recommending be reduced by $85 this year. While it's being reduced by $85, I'm also assuming the contract costs for the shredding services, the townwide shredding services. So I've absorbed $500 something, I think it's $540 in cost for the shredding services, and I'm reducing that line by another $85. FinCom expenses, this line covers dues payment for the finance committee. The current dues payment is $160 a year. We don't know whether or not that's going up, so the recommendation is to leave it level funded. Reserve fund, this has been funded at $95,000 since FY 20. So last year and this year it's funded at $95,000. Last year, there was a remaining balance of $59,817.06 in the reserve fund. This year, there have been no requests for reserve fund transfers to date. So,
Well, there shouldn't be in the first 6 months of the year.
no, there shouldn't, but there was an extraordinary, last year, for example, there was an extraordinary situation where the plastics compactor at the transfer station went, and it wasn't a situation where you could let the plastics pile up. So that did happen early on.
Yep.
Okay. So no
Typically it
requests.
was typically reserve fund is one of those line items that, at least when I was on FinCom, we played around with a little bit after we saw everything else in the budget, because we sometimes want it to go up, but if things are really, really tight, we'll try to lower it down.
Oh, okay. Because it deals with extraordinary.
I wouldn't stop me from voting on it today, but
it deals with extraordinary and unforeseen expenditures, so it's hard to know what will come up, really. So, all right. Legal expenses. In FY '20, we only expended 68.7% of the legal expenses line. This year to date, we are at 33% expended. I expect that this line is going to be close to fully expended by the end of this year because of the negotiations. We have 2 collective bargaining agreements that we're going to be negotiating this year. So I expect that this line will be fully expended. That said, I'm recommending that it be level funded. Concom expenses, this line was reduced last year by this year by $200 when we went through with the budget reductions. Concom has submitted a budget request of $2,000 for next year. With these budgets, with this particular budget, they pay for their annual dues, Concom handbooks, postage reimbursements, and this year they've actually spent a little bit of money on materials for trail repairs. This year it is at 55% expended. And last year it was 78.67% expended. Okay. Ag Commission. The Ag Commission pays for the tilling. They are now paying for electricity for the water pump in the shed. That said, they have still reduced their budget by $95, down to $1,330. They do believe that they'll be able to pay all their electricity bills and the other ancillary costs at the community garden with that funding. Last year, the Ag Commission's total expenditures were $593.50, or it was 41.65% spent last year. Town report expenses. In FY '20, the amount spent on the town reports was $3,964.57. Even with the increased population in town and the projected additional books that are going to have to be sent, I believe that we are going to be able to stay within the $5,000 this year. And of course, the board is supposed to be talking at some point later on about potential bylaw changes on the delivery of town reports. Now, on the animal inspector expenses, previously that was budgeted at $925. We reduced it to $425 by $425 this year with the COVID budget reductions, so it's down to $500. This line pays primarily for rabies testing. It may pay for the book of licenses that the Department of Agricultural Resources requires, but otherwise it's paying for rabies testing when and if needed. Last year there was no money spent from this. This year there was no money spent from this. So essentially this is a contingency in case there's rabies testing needed. Human Services, Board of Health expenses. This is another line that was reduced with the COVID reductions this year. This line pays for postage, reimbursements for postage. I don't know that any dues have been paid out of this. However, it also pays for office supplies. So this line is now reduced by another $200 for FY '22. And I am recommending the $1,000 as requested by the Board of Health. Cultural Council expenses. This essentially is 3 events three. This is a pain in the neck. I'm using my laptop and not a keyboard, and it's really a pain.
That's fine.
All right. This
So
is
the Cultural
500
Commission, go ahead.
Yeah, they provide grants to local organizations that are
Right.
helping. So 500.
We added this to the budget at a time where the belief was the state was going to stop funding cultural commissions. And they were, and we decided we still wanted things going on in the town. Did in fact the state stop funding cultural commissions, or is this now duplicative money?
I don't think this is duplicate money. I do think the state cultural commission does fund programs, but I believe the funding for the programs here is coming directly from our local cultural council. I can get confirmation of that
Yep.
from the council, but I don't believe there's additional state funds supplementing their work at this time.
Okay.
I think the state is funding
Yep.
events separately.
I have several, not for tonight because you're not hitting, except for this one, not hitting those items, places where when on FinCom, lines were added for temporary things that were going to go away that have both never gone away but grown. And at a FinCom level, I didn't have the ability to say, why is this still here? Let's make it go away. At the select board, I might have more ability to understand those better. That doesn't mean I want it away, but
Yeah,
you know, if you change the use of a line from a temporary staff for filing only that's going to happen for 2 years to a permanent staff person who's now there forever, let's admit that it's there forever and understand what benefit that's adding to the community.
okay, Scott, I may not have the entire history of all these things, so if you could fill me in on some of those, it would help me with the background on them. Okay.
Yep.
The Memorial Day expenses. Memorial Day expenses cover the cost of flags for the graves, flowers for Memorial Day, and needless to say, this year there was very little expended. Hopefully, they will be able to get back to some sort of ceremonies honoring the veterans on Memorial Day. So this was reduced by $100 this year with the COVID cuts, and the request has come in at $2,000 again, so I'm recommending that. Festive events used to be at $2,100. Needless to say, that was probably one of the easier lines to cut for COVID this year. The proposal is to keep it funded at $500 in case there is a town-sponsored festive event where that money could be applied.
And we feel festive.
And we actually feel festive. That might not happen. Yeah. Let's hope that happens in FY20.
Yeah.
Okay. Interest in principal. This was a big win this year with paying off the ladder truck debt. This was on budget debt. It was not excluded from the tax levy. So the taxpayers were absorbing all of this debt on the operating budget. So the administrative finance team recommended, and the finance committee agreed, and the board agreed that we should go ahead and pay off the ladder truck debt, paying it off 1 year early. So it has come off. The budget for FY22, and therefore you see significant savings. That $245,052, that is the actual amount that was paid on the ladder truck. So that amount is off once and for all. Workers' comp, our insurer, workers' comp and property liability, might as well bundle these together. Our insurer has advised that we should expect a 5 to 10% increase in the actual premiums that were billed for this year. We expended under the amounts that were budgeted. We think that at this point, the workers' comp premium and the property liability insurance premium will come in under the budgeted amounts for the current year. So there's no recommended increases in those lines either. And
no ability to decrease them then because of that?
We can't decrease them at this point because they are very, very close. For example, hold on, let me get on my sheets.
Yeah, that answer's fine.
The workers' comp, with the credits they also give us credits during the course of the year, and those credits can be somewhat unpredictable. With the credits, we are at 89.6% expended, and we are at 95% expended without the credits. So clearly we are expecting some credits. And the property liability, we're at 82.3% expended with the credits and 90.3% expended without the credits. I don't think it would be advisable to decrease those lines at this point.
Okay. Questions? If we haven't asked them already.
Okay.
No, so it's the next step then is a motion to approve the 18 lines recommended, budget lines recommended by the town administrator.
Correct.
That would be it.
I would so move that.
And I would so second that.
All right. If there's nothing further to be said, then we'll take a vote. Keith, aye.
Stone Eye.
Hawkins, aye.
These were
Thank
the
you.
easy ones.
There's the
Well
tip of
done,
the iceberg.
M2. Well done.
Very nice. All right. Board questions and comments.
Nope, I said I had none. I'm done. I'm at my fidgeting limit, so yeah, I'm done.
Yeah. All right. Then we will not be going into executive session this evening. So I would entertain a motion to adjourn.
So moved.
Second,
Okay, Keith, aye.
Stone Eye.
Hawkins, aye.